If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
I know every operating system like the back of my hand.
When it comes to 5 years of experience and have worked with several people from your company, I've been recognized for my passion. My team is everything.
LinkedIn delivers candidates who rise above the rest. With an up-to-date view into shared connections, skills, and interests you won't find anywhere else. See why 86% of small businesses who post a job on LinkedIn get a qualified candidate within a day. Post a job for free at linkedin.com/achieve. LinkedIn, your next great hire is here.
Every Who down in Who Newville liked the holidays a ton. But where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one Who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today we'll be reviewing 3 gastrointestinal questions. Just a reminder that you can find these questions and many more on our website at medprep2go.com. If you'd like to get involved in this project and learn how to develop questions, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know about it. And you can learn more about me and my projects at tedxoconnell.com. All right, let's get started with the first question. A 4-week-old former full-term infant is brought to the emergency department by his parents for vomiting. The mother explains that she exclusively breastfeeds the infant, and for the past 2 weeks he has vomited after every meal but still appears hungry. She describes that the vomiting has increased intensity over the last week, and the infant now forcefully vomits. Upon further questioning, the mother describes the emesis as non-bilious and consists only of breast milk. However, today the vomit contained what appeared to be bright red blood. The patient's mother received routine prenatal care, and the delivery and postnatal course were uneventful. On physical examination, the infant is afebrile and appears somnolent. The fontanelle appears slightly sunken. Lung sounds are clear to auscultation, and a 1 centimeter mass is palpated in the epigastric area of the abdomen. Serum laboratory results reveal the following: sodium, 138 milliequivalents per liter, potassium, 2.5 milliequivalents per liter, chloride, 88 milliequivalents per liter, bicarbonate, 30 milliequivalents per liter, creatinine, 0.2 milligrams per deciliter, BUN, less than 5 milligrams per deciliter. Which of the following is the most likely source of bleeding in this patient? A, deficiency of clotting factors. B, ingestion of a foreign body. C, invasive bacterial infection. D, tear in the esophageal mucosa. Or E, ulceration of gastric mucosa. The correct answer is D, tear in the esophageal mucosa. This is a presentation of infantile hypertrophic pyloric stenosis, which is a hypertrophy of the pyloric sphincter muscle. This condition usually presents between 3 and 5 weeks of age with immediate postprandial vomiting that is forceful and non-bilious. The infant demands to be refed soon after the vomiting occurs. A small olive-shaped mass can classically be palpated in the right upper quadrant of the abdomen at the lateral edge of the rectus abdominis muscle. The repetitive vomiting creates a hypochloremic, hypokalemic metabolic alkalosis, as is demonstrated in the vignette. In this infant, the forceful vomiting resulted in a Mallory-Weiss tear, which is a tear in the esophageal mucosa, resulting in blood in the emesis. Answer choice A, deficiency of clotting factors, is incorrect. A deficiency of clotting factors would most likely lead to additional manifestations of bleeding without the suggestion of infantile hypertrophic pyloric stenosis. Answer choice B, ingestion of a foreign body, is incorrect. The vignette does not suggest ingestion of a foreign body, which would be unlikely in such a young infant unless there were a toddler sibling who might be involved. The hypochloremic, hypokalemic metabolic alkalosis is also inconsistent with foreign body ingestion. Answer choice C, invasive bacterial infection, is incorrect. The vignette is most consistent with a gastrointestinal etiology, and the lack of fever or diarrhea makes an invasive bacterial infection less likely. Answer choice E, ulceration of gastric mucosa, is incorrect. This would be seen in peptic ulcer disease, which is not suggested by the clinical vignette. The key learning point of this question: forceful vomiting can result in a Mallory-Weiss tear, which is a tear in the esophageal mucosa that results in hematemesis. Question 2. A 1-year-old boy presents with his father to the emergency department with bloody diarrhea, bilious vomiting, and irritability. The father states the symptoms developed yesterday and have persisted today. Past medical history is unremarkable. Vital signs are temperature 37.2 degrees Celsius or 99 degrees Fahrenheit, blood pressure 90/70 millimeters of mercury, heart rate 165 beats per minute, and respirations 22 per minute. Physical examination reveals increased bowel sounds, a palpable mass in the abdomen, and tenderness to palpation in the right lower quadrant of the abdomen. Which of the following is the most likely etiology of this patient's symptoms? A, congenital failure of the duodenum to canalize. B, enlargement of the pyloric smooth muscle. C, failure of involution of the vitelline duct. D, failure of neural crest cells to descend into the myenteric and submucosal plexus. Or E, obstruction of the appendix secondary to lymphoid hyperplasia. The correct answer is C, failure of involution of the vitelline duct. Based on this patient's age and clinical presentation, the most likely etiology for this patient's symptoms is intussusception due to Meckel diverticulum, which is caused by persistence of the vitelline duct. Meckel diverticulum is the most common congenital anomaly of the gastrointestinal tract and is the most frequent cause of intussusception. Signs of intussusception include current jelly stools, bilious vomiting, and increased bowel sounds. The rule of twos is important to remember about Meckel diverticulum. 2 times as likely in males, 2 inches long, 2 feet from the ileocecal valve, 2% of the population, and most commonly presents within the first 2 years of life. Answer choice A, congenital failure of the duodenum to canalize, is incorrect. This refers to duodenal atresia. Although these patients will sometimes present with bilious vomiting, symptoms will typically present within the first 1 or 2 days of life. Answer choice B, enlargement of the pyloric smooth muscle, is incorrect. This refers to hypertrophic pyloric stenosis. Although these patients will sometimes present with a palpable abdominal mass, symptoms will typically present within the first 3 to 6 weeks of life and usually include bilious vomiting. Answer choice D, failure of neural crest cells to descend into the myenteric and submucosal plexus, is incorrect. This refers to intussusception due to Peyerpatch hypertrophy. which is most commonly associated with a recent viral infection. Although this could surely lead to this patient's symptoms, there is nothing in the question stem that hints toward a possible viral infection. Answer choice E, obstruction of the appendix secondary to lymphoid hyperplasia, is incorrect. This refers to Hirschsprung disease, which is characterized by lack of nervous plexuses in the distal segment of the colon. Although these patients could present with bilious emesis, symptoms will typically present within the first 1 to 2 days of life, and no palpable mass is usually present, although the abdomen may be distended due to chronic constipation. The key learning point, Meckel diverticulum, which is caused by persistence of the vitelline duct, presents with current jelly stools, bilious vomiting, and increased bowel sounds.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Building a portfolio with Fidelity Basket Portfolios is kind of like making a sandwich. It's as simple as picking your stocks and ETFs, sort of like your meats and other toppings, and managing it as one big, juicy investment. Now that's pretty good. Learn more at fidelity.com/baskets. Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC. Member NYSE SIPC.
Question 3. A 57-year-old woman presents to the emergency department for severe, constant, right upper quadrant abdominal pain for the past week. Over this time period, she reports inability to pass bowel movements or flatus, and she endorses nausea with a few episodes of non-bloody, non-bilious vomiting. She has a history of recurrent cholelithiasis, but has declined surgery in the past. Vital signs are within normal limits, except for a heart rate of 110 beats per minute. Physical examination reveals that her abdomen is diffusely tender and distended with hypoactive bowel sounds. Abdominal x-rays show free air in the biliary tree. Which of the following describes the pathophysiology of the most likely complication of the patient's gallstone condition? A. Acute inflammation of the gallbladder due to calculus deposits at the cystic duct. B. Common hepatic duct obstruction due to extrinsic compression from an impacted gallstone in the cystic duct. C. Gallstone passage through a fistula between the gallbladder and small bowel, causing impaction at the ileocecal valve. D. Obstruction of the common bile duct due to dislodged gallstone. Or E. Obstruction of the pancreatic duct due to dislodged gallstone. The correct answer is C. Gallstone passage through a fistula between the gallbladder and small bowel, causing impaction at the ileocecal valve. This vignette most likely describes gallstone ileus, a relatively uncommon complication of cholelithiasis that occurs due to an aberrant connection between the gallbladder and small bowel. The combination of fever and right upper quadrant abdominal pain with signs of a small bowel obstruction point toward impaction of the gallbladder within the gastrointestinal tract. The presence of free air in the biliary tree, called pneumobilia, is a supportive feature of gallstone ileus. Answer choice A, acute inflammation of the gallbladder due to calculus deposits at the cystic duct, is incorrect. This describes acute cholecystitis, which presents with fever and right upper quadrant abdominal pain without jaundice. Pneumobilia may be present in cases of emphysematous cholecystitis if there is infection with gas-forming organisms, though air is typically trapped in the gallbladder itself rather than the greater biliary tree. Additionally, cholecystitis classically does not present with signs of small bowel obstruction. Answer choice B, common hepatic duct obstruction due to extrinsic compression from an impacted gallstone in the cystic duct, is incorrect. This descriptor fits the diagnosis of Merizi syndrome, which classically presents with fever, jaundice, and right upper quadrant abdominal pain. Merizi syndrome is less likely in this case due to the absence of jaundice. Additionally, it classically does not present with signs of small bowel obstruction. Answer choice E, obstruction of the pancreatic duct due to dislodged gallstone, is incorrect. This describes gallstone pancreatitis. Although fever and nausea may be present, this more classically presents with epigastric pain. Additionally, gallstone pancreatitis classically does not present with signs of small bowel obstruction. Answer choice D, obstruction of the common bile duct due to dislodged gallstone, is incorrect. This describes ascending cholangitis, a serious inflammation of the common bile duct that presents with a triad of fever, jaundice, and right upper quadrant abdominal pain, as in Merizi syndrome. Pneumobilia may be present in cases of infection with gas-producing organisms such as Clostridium perfringens. However, ascending cholangitis classically does not present with signs of small bowel obstruction. The key learning point: gallstone ileus is a relatively uncommon complication of cholelithiasis that occurs due to an aberrant connection between the gallbladder and small bowel. That's it for this episode, but please do check out our other episodes, and a reminder that you can find these questions and many more at bedprep2go.com. If you like the content of these questions, please also check out the Crush Step 1 podcast.
There's fishing, and then there's fishing. Out here, you're after dinner. Online, hackers are after your data. They'll bait you with fake emails, lookalike sites, anything to lure you in. But with Cisco Duo's end-to-end phishing-resistant access control, every login, every device, every user stays protected. Looks like no one's biting today. Cisco Duo. Phishing season is over. Learn more at duo.com.